Good afternoon, guys. I have discussion C for you. We are discussing quality of elder care. Specifically, quality in senior home care isn't just about being kind, present, or attentive. It's about whether care practices, reliability, produce better outcomes for older adults. It highlights a growing exception that home care agencies demonstrate not only what they do, but what those actions achieve: safer environments, fewer preventable crises, more comfort and support that aligns with each person's goals. By measuring both quality and outcomes, families and providers can ensure care remains humane, individualized, and effective. Key concepts the page highlights: quality versus outcomes. Quality reflects the consistency and professionalism of care delivery, training, safety routines, communication. Outcomes reflect the lived experience, the lived results: fewer falls, better symptom control, reduced stress, and more independence and improved well-being. Person-centered measurements. Effective measurement adapts to the older adult's unique needs, preferences, and goals rather than relying solely on standardized checklists. Why measurement matters. Without measurement, families can't compare providers, and agencies can't identify gaps or improve. With measurement, care becomes more transparent, accountable, and aligned with what matters most to the individual. Practical measures and matrices described on or implied. Process indicators, staffing ratios, caregiver training and certifications, adherence to safety protocols, frequency of care plan updates, communication practices with families, outcome indicators, fall rates, hospitalizations or ER visits, medication error, changes in mobility or ability to perform daily activities of living. Emotional well-being, pain control, overall comfort. Experience measures, resident and family feedback on dignity, respect, responsiveness, cultural sensitivity, and communication clarity. These often reveal issues that numbers alone can't capture. These categories mirror the broader shift in aging services toward value-based care, where success is defined by results, not just tasks completed. How providers and families use these measures. Providers use process matrix to redefine training, adjust staffing, and strengthen protocols. They use outcome data to evaluate whether those improvements translate into better resident experiences and safety. Families use outcome trends and satisfaction data to choose a provider, monitor ongoing care, and raise concerns early when patterns shift, such as increased falls. Missed medications or changes in mood. Limitations and cautions the page implies. Context matters. A fall rate or hospitalization number means little without understanding the person's health status, home environment, and risk factors. One size fits all matrix can can mislead. A provider may score well on genetic benchmarkers, yet fail to meet an individual's cultural, emotional, or functional needs. Data without interpretation can create false reassurance. Numbers must be paired with narrative explanations and ongoing dialogue with caregivers. Actionable next steps for families or care teams. Ask providers for both process and outcome data. Staffing levels, training standards, fall readmission rates, medication error tracking, and satisfaction surveys. Request a personalized care plan tied to the older adult's goals, and ask how process will be measured and communicated. Review trends over time, not isolated incidents, to judge whether care is improving, declining, or staying consistent. Encourage providers to include family input, quality reviews, especially when subtle changes in mood, appetite, or behavior appear. Look for agencies that treat measurement as a tool for partnership, not as a marketing checkbox. Single most important takeaway: the real measure of quality in senior home care is not just how care is delivered, but what it accomplishes for the person, their safety, comfort, dignity, and ability to live according to their own goals. The CMS explains what home health quality measures are and how they grouped, where the data comes from, and how the measures are used for public reporting and quality. Implement it frames measures as three complementary types: outcome, process, and patient reported, and describes the data, sources, and calculation approaches. CMS uses each the three measured types and what they mean. Outcome measures track the results. Patients experience, for example, improvement in function, hospital use, or avoidable events. Many outcome measures are risk adjusted. Agencies serving sicker populations can be compared to compared fairly. Process measures show how often agencies follow evidence-based care processes. For example, timely start of care, immunization offers, medication review. These are not risk adjusted because the processes apply to all eligible patients. Patient reported outcome measures collected through the HHCAHPS survey. These capture real time uses of different components. Okay, guys, that's your C. I'm gonna take a little break. I'll be back on with D shortly. For now, Gator Wellness and Aging. I will see you guys for D shortly. For now, take care, folks.